welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, and with me as always are my fabulous co-hosts.
Hey Rob, it's Diana.
And it's Jackie.
What's up, you guys?
What up?
So I think it is important for us to always be looking for topics on our show to discuss, because we love to discuss behavior analysis and behavior analytic research. And while
We love it.
We love it. And while I think sometimes we want to stick to some well-worn topics, sometimes we want to go out and do something a little different. And that's that's the ABA Inside Track promise. We're going to do something a little different sometimes. And while we're going to be talking about research, I think this week's topic is going to be one that's a little different from some of our other episodes. We are going to be talking about acceptance and commitment therapy. Something which we don't know a lot about.
Nothing about.
And so what should we do when we don't know a lot about something?
We look it up.
Forge ahead.
Make it up. No, no, that's...
Stumble blindly.
No, it's you look it up.
I learned that from Elmo's World.
That's you look in a book. What's that, Super Y?
Yeah, it's
That's
Super Y.
Okay. So we decided not just to look it up, but also to reach out to an expert in the field. So we have two articles that we'll be discussing, and then we will be bringing on our very special guest for this episode, Dr. Adam Hahs. So the two articles we'll be discussing were ones he recommended to learn a little bit more about ACT, and they are Embracing Your Demons, an overview of acceptance and commitment therapy by Hahs, and that's from Psychotherapy in Australia, 2006, a journal we reference all the time. And then we'll be talking about Randomized Controlled Trial of a Brief Acceptance and Commitment Training for Parents of Individuals Diagnosed with Autism Spectrum Disorders by Adam Hahs, Dr. Mark Dixon, and Dr. Dana Paliliunas in the Journal of Contextual Behavioral Science, and that's in press.
Yeah.
We're right up to the minute with this. All right. And so because, of course, it's always nice to hear from the researchers who done the research, here is Dr. Adam Hahs. Adam, hi. Thank you so very much for being on ABA Inside Track. We're very excited to hear all about ACT.
Yeah, it's great to be here.
Before we get started, could you please tell the audience a little bit about yourself?
Sure. I received my PhD in 2013 from Southern Illinois Carbondale.
Woo-woo!
I'm now clinical. Woo-woo! I'm now clinical assistant professor and director of the Masters of Science in Applied Behavior Analysis program at Arizona State University in the Department of Psychology. And been there since 2015. Pretty good stretch, but happy to be here to talk a little bit about ACT and some of the work that I've done and others have done.
Beautiful. Well, we have
Awesome.
We have a lot to cover. So
We sure do.
I think the first thing, because again, some of our listeners will know what ACT is, some will not. What is the ACT elevator pitch? You got to sell it to us before we get to the fifth floor of the conference center or wherever we are.
Yeah, I mean, I think one of the first things that I would say is that ACT it's a therapeutic approach, and it's kind of different from that which Western psychology has taken. Specifically, that most of the efforts that we make in Western psychology are that there's an effort to reduce suffering, and that any suffering that we might have is bad or labeled abnormal. And so traditional efforts have been to reduce those symptoms and any of the behavioral phenotypes that accompany some disorder. And ACT takes a slightly different stance that suggests that it's normal to have those challenges, and that the relationship that we have with them is something that we can work with and create space for. And it does so by kind of incorporating two specific viewpoints or stances with respect to what's called psychological inflexibility, experiential avoidance. And those two things are kind of mindfulness-based processes or efforts, and then behavior change or reinforcer focused processes.
I'm gonna stop you and
Yeah.
ask, I'm gonna
Slow elevator, man.
I know. I'm gonna pull you back though, and I'm gonna ask you, what does ACT stand for?
Yeah, it'd probably be helpful to talk a little bit about that. ACT stands for Acceptance and Commitment Therapy.
And where did it come from? Like, how did this come about?
Yeah. Again, kind of harkening back to the idea that suffering is abnormal. There are a couple guys, Steve Hahs and Kurt Strassel and Kelly Wilson, took a slightly different stance and created this behavioral theory called relational frame theory, or RFT. And it takes the stance that a lot of the suffering, and both good and bad, so the good things that come out of language are a product of what's called derived relational responding. And unfortunately, where there is light, there is dark. And so when we have the beauty of language, such as being able to problem solve and talk, states away, as we are now, comes the dark side of language that often accompanies it. And so things like depression and anxiety and suicidality, those things are pretty difficult topics, but RFT posits that those things are a function of our ability to language.
Right. So when Yoda said that fear leads to anger, and anger leads to hate, and hate leads to suffering, do you feel that is a linear progression, or that ACT could make a change in that pathway?
Yeah, I think that ACT takes the stance that there's enough room for all of the bad, and that in our behavioral repertoires, we're not defined by the things that we think, but they are just one component or part of us. And our ability to problem solve is kind of a double-edged sword, right? I sent you guys the Russ Harris article, and I think he very parsimoniously and articulately kind of describes what it means to have that ability to language, and the things that it affords us, but also the challenges that it might generate in terms of experiential avoidance. Our traditional approaches, when we hear a problem or we label something as a problem, such as being a bad parent, then the quote unquote natural thing for us to do is figure out a solution or a way to fix it. And it's in that attempt to fix it that we often run into even more problems.
I loved his quicksand metaphor, right? So like the more you're in a situation and you're experiencing bad thoughts and you're trying to fix it yourself, you're really just digging yourself deeper into that way of thinking. And the best thing to do is let it go and rise above the quicksand.
Yeah, and it, if you want to kind of strip all the metaphor away and think behavior analytically, oftentimes what I'll tell my students is, we get in the habit of trying to fix things and do when we go and observe behavior. And oftentimes doing nothing is a good option. Just kind of sit back and observe things, and answers, interestingly, may come. So.
That's deep, man.
Oh, it is deep. So how does ACT and behavior analysis, are they the same, or is ACT part of behavior analysis? This is something that's always confused me a little bit. Can you clarify that distinction for me, if there is one?
ACT is kind of a hot topic within behavior analysis right now, and there's delicious sandwiches that you eat up and the center remains relatively cool. I think there's a lot of work being done in behavior analysis by behavior analysts to kind of adopt ACT as an approach. And one of those things is a terminological change. Instead of acceptance and commitment therapy, there's this movement to change the T to training. And I think it's done in an effort to kind of distance the practice that behavior analysts can and often do from the kind of the thing that comes up when you hear therapy, which is like, lay on a couch and I'm going to talk to you about your problems.
Right.
The training is meant to kind of conjure this idea of using behavior analysis in a way that folds in some of these empirically and evidence-based approaches that ACT brings. And so guys like Jonathan Tarbox and Emily Sandos and Lisa Coyne and Evelyn Gould are doing some really cool stuff about, how do we make this accessible to behavior analysts who may not have had the traditional kind of psychotherapeutic upbringing and lineage. And I think they're doing some great work to that end. And I'm hopeful to support that as well.
Adam, how did you yourself come to want to learn and research ACT? Because I know of the three of us here, I'm probably the most interested in, say, like the behavior therapies and mental health issues. But certainly even I, having like really wanting to find those behavior therapies that work, reading some of the articles and is, like you said, the Harris article is very well written, but there again is purposefully a lot of metaphor used. I mean, just hearing the term mindfulness, I'm automatically, got some of my barriers up, like, oh, mindfulness, this isn't okay. I'm going to be unethical if I keep reading this article. I better, go tell someone about this. Like, how did you either come to terms with some of the language? Did it never bother you?
Yeah, I mean, I think that the language is kind of the way we talk about this thing. And quite honestly, I think it's one of semantics. If you want to break down some of those, the 6 core processes within ACT, we can provide operational definitions. One thing behavior analysts are pretty good at is providing good operational definitions. And I don't know if it would be of benefit to do that now. I can do that if you want.
It's on the list of questions that we wanted to talk about. So it now seems like a good time as any.
Maybe I can talk kind of in lay terms and then provide you with what I might consider better operational definitions that maybe behavior analysts can wrap their heads around. And then I think it would also be helpful to potentially talk about how this might be used when we talk with kids, or what this might look like in practice. So kind of 3 levels of the operational definitions if you want.
I can't wait.
Yes, we do. I'm definitely want that. Please.
Okay, cool. Yeah, so why don't we let's start with diffusion. So one of the ways that the components of ACT are often laid out is in what's called a hexaflex, and you need not use. It is a cool word, right?
It reminded me of those little toys that you can buy at the store that are like little burrow bodies. They're like hex bugs.
They're like bugs, but they're
yeah. I was like, ooh, hexaflex bug, and then I was like, no, that's not the same thing.
Yeah, but no, it's a nice way to round out that kind of inclusion. I like that.
Thank you.
Yeah. So when you think of diffusion, it's kind of taking thoughts, feelings, and emotions for what they are, and not necessarily placing a lot more of a function onto them than what they are. We often label our thoughts, feelings, and emotions as good or bad. And the idea behind cognitive diffusion is to make an effort, maybe not to do that as much, to make space for it. And making space for it is in essence meaning like have some behavioral flexibility around those thoughts. And so if I want to then kind of operationalize that, something I'd say about it is behavioral flexibility in the presence of stimuli that occasion narrow patterns of activity. Mm-hmm. And so our goal in terms of behavior analysis might be not necessarily changing the thought, but the interaction with the thought. And we can do that by creating environments or contexts in which those unhelpful functions of thoughts can be diminished. And so that's diffusion.
Okay. So the idea here is that your thoughts are covert behavior and nothing more, right? Like that's sort of like the beginning point here.
The skin is only a barrier, right?
Sure.
Skinner said it best. The skin is only a barrier to analysis. Mm-hmm. And we're really, in an effort to tap into that, I think that we're taking a different look at these covert stimuli.
Yes. Great. So like we as humans get ourselves all worked up by the things that we're thinking, and then we just get ourselves more and more stuck in that same pattern of thinking. But the first step with diffusion is to take a step back from that and think about what you're thinking and see it as just covert words.
Yeah, and I think it was Kelly Wilson that said oftentimes we're not afraid of the thing, we're fearful of the fear of the thing.
Yeah.
And what our fear is often verbally constructed versus stimuli. So that's diffusion. Second one that we can talk about is acceptance. A lot of these are interrelated. And so when we talk about acceptance, we're often touching on pieces of diffusion too, but acceptance is just making room for unpleasant thoughts, feelings, and emotions. And most often we're talking about those private events that are verbal in nature. In terms of behavior analytic operational definitions, I'd call it alternative responses to difficult psychological experiences, those covert verbal stimuli. And one thing I'd mention about acceptance that I think our literature does a pretty good job of doing is that it's not a resignation. It's not submission, right? We're not submitting to a thought, feeling, or emotion. And we're not resigning. We're not saying, oh, I can't do anything about that. That's not what we mean by acceptance in ACT. It's also not the other side. It's not approving or wanting or liking some particular stimulus, right?
Yeah. It's just
ideally,
allowing it to be.
Yeah. Ideally, it's kind of a move or behavior independent of judgment.
Yeah. I can see how it's emphasized here that this is different than overall like Western approach to psychology or psychotherapy, right? Because the focus is so different, just allowing yourself to like be and be okay with things versus immediately taking action with something. So I'm getting it. This is all making sense.
So when I read these two, what are they called? Two tenets of ACT. Are they what are they?
Yeah, components or tenets.
Yeah. So these components of ACT, I was thinking about. Well, first I was thinking like I love yoga, and yoga says this like every day, right? They're like, okay, now let's meditate.
Me too.
Yeah, they're like sit and be okay with what's going on. Do you think there's been, like any draw from Eastern thoughts? You know what I mean?
Yeah. No. I mean, I think when I mentioned the two overarching processes, mindfulness is one of those overarching processes of ACT. And so we would be foolish to kind of try to disconnect Eastern influences from what ACT is. And I think it spawns a great deal from that. Jon Kabat-Zinn is a guy notorious and kind of a guru in mindfulness. There's a cool story that my mentor in undergrad, Kelly Wilson, tells, and he said he was giving a talk on ACT, I think a grad student maybe, and in the back of the room was Jon Kabat-Zinn, where after the talk he went up and Kabat-Zinn said, that was great, and Kelly asked him, how do you get so good at mindfulness? And Jon Kabat-Zinn said, I practice. Mm-hmm. So a core kind of overlay to ACT is, so often we pick up things and to read and we're told things to do, and yet the practice that's required of getting good at something, not perfect, but better at something is kind of at the core of what ACT is. There's an experiential component that I think is really important.
Okay.
All right, I'm just going to have to pause the conversation for 1 second because I want to make sure that our listeners know, A, hopefully they're having a great time, and B, did you know that ABA Inside Track is ACE approved? Yes, by listening to our show, you too can get continuing education credits. All you need to do is, listen to the show, and then you can go apply for those credits on our website, abainsidetrack.com/get-CEUs. But you're going to need to know some information, most importantly, 2 secret code words that we've spread throughout our episode. So I'm going to give you the first of those now, and it is milk. M-I-L-K, milk, the substance that does a body good and gives you a mustache. Comes from cows or goats or, various creatures. Milk.
Almonds.
Soy. You're right.
Yes.
Milk.
I say milk.
You say milk. But if you write milk, we won't appreciate it, right? Milk.
Right, milk. The second thing that I was thinking about too is when you were talking about these negative thoughts or emotions and how, people perceive them. When I am teaching my students, we talk about those as a byproduct of the verbal community, right? So you don't know what you're thinking until your verbal community tells you it's bad, right?
Yeah.
So it shaped our verbal community. How does that align with this cognitive diffusion?
Yeah, I think one of the things that we, like you alluded to, there's an environment wherein we have reinforcing entities,
Right.
and those persons, based on that covert behavior coming overt, provide reinforcement and/or punishment for particular patterns of behavior. And so, I think we have an interesting, I'm going to use maybe a dirty word, but a predisposition to lump or group behavior and label it good and bad. And it's in that very doing that we create these aversions to particular patterns, and then other patterns of behavior are repetitive. And so diffusion aims to create some space such that there's an ability to loosen the stranglehold that verbal behavior has on our behavior, and that reinforcing entities can then place on it. And we're in a less judgy place when we can do that.
We all want to be in a less judgy place.
I don't. I love judging. I'm just kidding.
All right, that was number 2, right?
Yeah, that was 2 of 6.
Okay.
So we've got contact with the present moment or present moment. It's pretty self-explanatory, but I think that one of the things we want to do is just be open and aware in terms of kind of a lay definition, just being aware of your environment. And from a behavior analytic perspective, allowing the stimuli that need to be relevant, allow those to be salient, but kind of creating space for those to potentially influence our behavior as opposed to things that have occurred in the past or things that are upcoming. And when we're what we call in the present moment, that allows for us to be, and our behavior to be better influenced by those stimuli in our environment.
Mm. Adam, would you say that a lot of the activities that I think have been sort of popularized as part of the mindfulness movement sort of are that third value, that idea of, let's do mindful eating, let's have a mindful moment? I mean, are they basically the same idea, or is there a difference?
A difference between what? I'm sorry.
Oh, between some of like the kind of I think the pop mindfulness that you see, like Time Magazine says this is the year of mindfulness, and
like Headspace.
Put all the apps that you see, and like put Starburst in your mouth and chew on them, and be mindful of how gross it sounds.
I think the inclusion of behavior change processes within ACT are what I think distances it from your pop mindfulness. Because we are behavior analysts and we like overt behavior, I think that's the piece that the latter 3 components that we'll talk about start to get at. It's one thing to be mindful and present and, essentially be able to notice our thoughts, feelings, and emotions as they come up. It's yet another thing to then be able to take a slightly different perspective with respect to those things and behave in accordance with what we'll talk about in a bit, which is our values. Mm-hmm. And those are the behaviors of interest, right? I mean, that's what we're really interested in when we think of pro-social and vital life. We want to look at what those behaviors are and how they've changed, given our change to those covert stimuli. Yeah.
I have a weird question for you. It's like a side
note.
Yeah,
hit me.
Do you have to be a behavior analyst to do ACT?
No, I think ACT and the lines are kind of becoming a bit more clear with the efforts that behavior analysts are putting forth. But, most often clinical psychologists are the persons that have spearheaded the efforts, but you need not be a clinical psychologist either. There's, plenty of people in education and social work and counseling and more recently behavior analysis that found some utility. I mean, we talk about pragmatism, right? And I think that, truth equals workability for me at least. And so in my experiences of using ACT in ways that are within our ethical parameters, ACT has been workable for me. I've found some pragmatism in it. And so, I use that as my experience for continuing to use it in the future.
Mm-hmm. So, Adam, beyond I think we were at the contact with the present moment and then the observing self. How are those two? I kind of struggled a little bit with differing those 2 points. They seemed very similar.
Yeah, so I think we can think of observing self, or, it's often labeled as self as context, is another way to talk about it. Present moment allows us to have those environmental stimuli that are currently or presently occurring to kind of dictate how we might respond. Self as context is a bit broader in that we're really looking at all of us. And what I mean by that is we're not defined by the things that we think, feel, or things that happen to us. Rather, that's just a part of us, right? And so one way I kind of language about self as context is that as an orientation to my positive and negative experiences, right? And I, as a person, my behavior and me is the context in which those covert events happen. And what we want to distinguish that from is that those experiences make up everything that I am. And so we want to have those experiences being definitive of the person, right? Or not definitive of the person, excuse me. Mm-hmm. So there's a cool analogy or kind of way of talking about this. And when we think of, these negative experiences or thoughts and feelings and emotions, we can, one way to kind of talk about it is the storm is never too big for the sky.
Okay. That sounds
cool.
I mean?
Yeah. So when we have all the mess going on in our world, then there's still room for all of the good and neutral stimuli that we interact with. So.
Oh, lovely.
It is the therapy with metaphor, which they were very clear about. That's all the metaphors.
Well, sometimes it makes the highly aversive or repetitive kind of stimuli that we interact with, it makes it a little bit less scary when we use metaphors.
Okay.
And most of language, if you think about it, is metaphors. So
that's true.
It ties that in nicely.
Mm-hmm.
Let's move to, we talked about the observing self or self as context a bit. Values, I think, it's kind of where we can start to talk about what we care about, like what's most important to us. And I think that one of the things that I think is important to mention is that values aren't goals. Goals are something that we set, we reach, and then we say we've met that goal. Whereas a value is, I think of it as a kind of a verbally constructed consequence, and one in which we continue to work towards. So the other piece to values is that we hope that in creating them, we occasion behavioral variability. And so that behavioral variability in and of itself then becomes reinforcing.
That aligns really closely with what Skinner talked about in Science and Human Behavior under values, and how values, he said values are merely just rule-governed contingencies that shape our behavior. Yeah, Skinner was...
He's pretty smart.
Skinner's the man. He's a pretty smart guy. But
he's my BFF.
He's talking about things well ahead of his time that only later came to be couched in a way that are now starting to be used in these fashions. So it's really cool to see the link that science and human behavior has to what's being used now by behavior analysts with slightly different terminology. So.
Yeah. So when you said a value is not a goal would be like, I want to have behaved in this way to produce this end result. And a value is all along the way, I want to behave in accordance with these guidelines. Yeah,
I think, to give you an example, probably one of the biggest values I have is being a good parent.
Mm-hmm.
I don't get to buy my kid ice cream and stop and say, yeah, I've done my work for today and for the rest of my life. I'm done being a good parent.
Thank goodness that's not it, because I would have failed today. I didn't buy any ice cream.
Yeah, that doesn't define being a good parent, right?
Right.
So we can set goals of like, I want to take my kid to, to the mall or whatever, or go get ice cream and have that be a goal for interaction. But my question then becomes, what's that in service of? Right?
Yes.
And when you start to answer that question, you're then talking about value. That's where we get a lot of traction and movement in clients or students or parents, whoever it may be. We get movement in their behavior once we start to get values clarified.
Okay. So we have the values defined, and then the committed action is going to be what it is that we will do to achieve those values, or to be acting out those values.
Yeah, I would say to work towards those values.
Can you ever get to the end?
If it's a value, then it's something that we continue to work towards.
I think on your deathbed, you look back and you say, well, did I live a good life according to my values?
And was I a good parent?
Right.
That's something I might ask myself on my deathbed, and hopefully the answer is that my behavioral history has been in service of doing so.
Okay.
But yeah, I think committed action is just kind of how we allocate responses.
Okay.
To be in line with those values.
Great. And then behaving in line with those values functions as the reinforcer.
That's right. Yeah. I mean, we can kind of think about values as verbally constructed long-term reinforcers.
Right. Mm-hmm.
And that our committed action is in service of working towards those reinforcers or to contact them.
Mm-hmm. So
I like it.
So when engaged with ACT, you are working with an individual to sort of understand and not exactly move through, but to understand the 6 principles, and then to do activities related to the cognitive diffusion in terms of the additional acceptance, to define their values, and then to define the committed action in moving towards those values.
Yeah, and very little of the conversation would actually use these terms. Mm-hmm. I mean, I don't even think that it's necessary to bring these terms up in work. Mm-hmm. And so, for example, if I'm working with a parent who's quote unquote stuck, it wouldn't make a whole lot of sense for me to start throwing around cognitive diffusion and selfish contact.
Right.
It's just not very palatable. Rather, we talk about, what are some ways that, or some options in terms of our behavior that we might consider that we've never done, right? It's kind of this overarching stance within ACT about creative hopelessness. And it's the idea that looking back at your behavior, how has that helped you get unstuck, right?
Okay.
The idea is that, you get these laundry lists of efforts that individuals have made to try to work things out or fix things, right? And yet they're still talking to me.
You're the last resort.
Kind of
That's what you're saying.
No, I wouldn't say that. I think it's just a different perspective from which they can look at the challenges. And that is the foot in the door that suggests, well, maybe we can try a different stance concerning the challenging thoughts, feelings, and emotions.
So that ties into what you're saying about producing behavioral variation?
Yeah. I mean, first we need to, in essence, kind of self-assess what's happened. What behaviors have we engaged in to try to, quote unquote, fix the problem? And it's the very act of trying to control or fix often serves to exacerbate, right?
Yes.
So a common example is a chocolate cake, right? If I say, don't think about chocolate cake. Yeah, already, right? But now I don't want you to think about that. Don't think about how creamy it is or how rich
moist.
It might, and moist. And don't think about, if you're a milk drinker, how good that would taste after a big bite of chocolate cake.
That would taste delicious.
Right?
I don't even like cake.
Yeah, it sounds incredible, And yet, if I'm saying not to think of that, what we're really doing from a kind of a basic behavior analytic perspective is that we're creating relational frames. And so we kind of touched on relational frame theory, but we're creating context in which a frame of opposition is created. But in doing so, we're also making those things in a frame of coordination.
Which means?
Yeah, so a frame of sameness. So we talk about Murray Sidman and his 1970s work in terms of stimulus equivalence.
Yep.
Well, relational frame theory uses more general or generic terms to speak about or talk about relations other than that of equivalence. RFT adopts a frame of coordination as it's kind of equal to that of stimulus equivalence, and that in our attempts to limit or minimize thinking one thing, it inherently then becomes part of a frame of coordination. And so we often say, if you don't want it, you have it.
Okay.
I got that.
If you don't want it, you have it. Yep, that makes sense. Yeah. And you're just continuing to draw attention to it by trying not to think about it more and more so, right? And that's all that you're thinking about. And now I could really use some cake.
Yeah.
And milk.
And milk, yeah, cold milk.
Now, before we get into some more examples of ACT in action, let's take a little break. We'll be right back.
Do you want to be a BCBA?
Sure, we all do.
Now you can come to Regis College in Weston, Mass. to get your graduate degree.
Choose from any one of these courses.
Masters of Science in Applied Behavior Analysis.
Masters of Science in Special Education.
Dual degree in Special Ed and ABA.
Or be eligible for your postmaster's certificate.
You can complete your degree and be ready to sit for the exam in 2 years. And our 2017 grads had a 100% pass rate on the BACB exam.
Come enjoy practicum placement support, ethics mini handbooks, PhD-level professors, small class sizes, and a service trip to Iceland.
If interested, don't delay. Supplies are limited. Learn more at regiscollege.edu.
Again, that's www.regiscollege.edu, regiscollege.edu. One more time, www.regiscollege.edu. See you there!
And we are back talking about acceptance and commitment therapy, or acceptance and commitment training, with Dr. Adam Hahs. And let's talk a little bit more about some of that old research. So, Adam, let's move on to the research articles that you sent, specifically your research on using ACT with the parents of students with autism. I think that will be a nice way to kind of give an example of ACT in action.
Maybe the first person who's ever said that, right?
Has anyone ever written that book? They need to write that. That's the title.
Yeah, that's a book.
Yeah.
Yeah.
Of course it is.
Yeah, so...
late to the party.
I'll give you a little background maybe as to why this research came to be. Something I care very deeply about is kind of supporting people who can't or don't have the means to support themselves. Mm-hmm. This work occurred in St. Louis, Missouri, and part of St. Louis, the North St. Louis specifically, is less affluent. Certain areas are impoverished, and a good number of the families with whom I worked on this project, it took a lot out of them to have to come and meet me to get this experience and get this kind of level of support. So I wanted to provide something to them free of charge as a doc student, and that came in the form of parent training around, how they can kind of work with their loved ones, their children with autism. So that's
cool.
Kind of why I wanted to do this work, was that there wasn't a lot of literature. I think only one published study at the time that looked at work with parents of kids with autism, and that was J.T. Blackledge, I believe it was his dissertation as well. And he did a workshop-like approach using ACT as well.
Mm-hmm.
It's so
what
needed.
we
Yeah, we were talking about this
Mhm.
before we called you, and how, like we as practitioners can work with the children, but we have to recognize that we're not really working with the whole family, right? And the whole family dynamic is going to affect, the behavior of the kids ultimately.
Yeah, and the
Yeah,
idea that's played out in,
Right.
some of like the research in terms of outcomes
Mhm.
the parent, stress level, anxiety level, depression level has such an impact on the treatment outcomes, which you would think, well, if it's good treatment, it's good treatment. But remembering there's more to the family dynamic than just, hey, they got treatment, therefore everything's great.
Yeah, I think the ripple effect of a diagnosis is pretty profound. And so, I really wanted to give those families who didn't have support outside of their maybe IEP team or traditional clinician, behavior analysts, OTs, PTs, with a little bit more support on the back end for the parents. When you think of the implications of a diagnosis, you get parents who can't work as much, right? They're spending a lot of money for their kids' care and well-being. So, I just felt it kind of been one of my values is to give back, right? So that's kind of where this research spawned from.
So the goal was to provide brief ACT for the parents of children with autism. Brief because the last thing any parent wants to hear is, don't worry, we're going to help you with some of the things going on. It's going to take, 50, 60 hours. You have to come multiple times to a location, right?
Yeah, and kind of harkening back to the idea that a lot of these families didn't have extra money to be driving all over St. Louis to come meet me, right? And they're taking time out of their workday to come and be part of the study. And so I wanted brevity, and I wanted to see if in doing so I could have some sort of an impact. One of the focuses was just kind of on these verbal reports of their well-being. And so we kind of purposively included a bunch of self-reports such that we could access how it is that they felt about the gains or lack thereof with respect to the training that they had received. So we did, 2-hour workshops, and that was it.
Mm-hmm.
So we had 18 parents, and we broke those parents down into groups. We had a waitlist control group, and then one group that got all six components of the ACT in 2 separate workshops. We did 3 in one workshop, and then 3 components in a second.
This is an RCT. You should not gloss over that.
Yeah, it was a randomized controlled trial study. And so we matched the groups based on pre-test specific to Beck's depression inventory and the acceptance and action questionnaire. So we matched based on those scores.
Okay.
And then we did a between subjects pre-post test.
So I don't know if you want to talk about this now or later, but I was wondering, when you did this, you did study indirect measures, but what do you think some direct measures could have been that you could look at?
Yeah, I think, one of the things that in hindsight would have been lovely to have included would be things like behavior in line with their values.
Oh, I love that.
Yeah, so if we want to operationally define what the values are, and then within that operational definition give examples of behaviors that are in service of the values, then we have it, right?
Mm-hmm.
We can objectively capture that as it occurs.
Mm-hmm.
That would be one of the biggies. On the flip side, in terms of, we use self-monitoring a lot in behavior analysis, right?
Yeah.
And so we could quite simply have them have a log of, their thoughts, feelings, and emotions as they come up, and then their behavior with respect to that and what they did. And I think that very feasible, kind of low-hanging fruit that could be done.
Yeah, I like that idea. I love that you used all these measures and you looked at them, multiple times across the treatment and control group. And then I was wondering, like, how, maybe you didn't think about this, but how do you think verbal report, like, fared with actually what they did, right? So we all know with research suggests that verbal report isn't as accurate as actual behavior. How do you feel about that in your study?
I think it would be short-sighted to think that we don't need to consider that literature, right? And yet I'm most interested in a parent. Hopefully there's not the bias that they're coming into the room saying what I want to hear.
Sure.
But saying actually, what's happened, right?
Mm-hmm.
So I think that it's very feasible that parents would report one thing and actually behave in another way. And I think it'd be, like I said, kind of silly not to think that could happen. But,
sure.
Because of the nature of the training or therapy itself, there is somewhat of a reliance on being honest and being open about your experiences. So I think the early goal is to kind of paint that space of, it's a quote unquote safe space. And, I don't have a magic wand, right?
I do.
As a clinician,
right.
Yeah. Jackie, you do, right?
Yeah, it's in my closet.
Yeah.
It's got a star on the top and it makes music when I wave it.
Yeah, so I think it's, again, just another perspective from which I can help them kind of navigate challenges. And the idea and the literature does support that in doing so we can see little movements here and there.
Mm-hmm.
Some of the early literature looks at not necessarily that there's these huge changes in the frequency of behavior, but in the believability of the thoughts, feelings, and emotions.
And, whenever we're talking about covert behavior, we have to rely on verbal report. We're never going to be able to see what someone else is thinking.
No, it's true.
So it's almost as though you can think about these changes here as like an overall social validity assessment, right? Of how do you feel that this whole experience was for you? And we take those at face value, right?
Sure.
If someone says, I feel that this helped my child, or I feel that this was an acceptable treatment, we take those verbal reports for what they are.
That's
so
right.
we could kind of think about this in the same way.
And just as we do with non-vocal verbal behavior, we create, kind of try to make sense of the antecedents and consequences of that behavior. So too do we do that for verbal reports, verbal functional analyses in a sense.
Yeah.
So I want to move back to the therapy that happened. So it was mostly it was your the 2 sessions. I know you mentioned in the article that there was a PowerPoint presentation. There were a lot of exercises. Were these all group exercises that the participants were doing with each other, doing with you, breakout sessions?
Yeah. So this came at a time when ACT was relatively new within, behavior analysis in terms of it kind of having some legs. And so one of the things that I wanted to do was ensure the integrity. And so we really kind of purposefully laid everything out in that PowerPoint such that there was integrity to the content. Interestingly, it kind of cuts against what ACT is and what it's meant to be about, which is allowing for, as things come up, to address those. And so I had to kind of do a little bit of a balancing act between, making it as technical as possible such that readers could understand what I did, but also not jeopardizing the nature of what ACT is. And so this was kind of the place where we landed. Most often these exercises were, there's very little content on slides. And that too is proposed so that there's not just reading going on, but that is in essence the SD for this kind of series of interactions with the group.
Right.
And so
it's the process.
Right. So is the group, so if you have an activity, does the group think about it alone and then write it down? Or do they speak with each other? Do you walk around? Is it
Yeah,
didactic
I'm
in
floating
nature?
around.
Yeah.
Yeah, I'm floating around the entire time. And then, I mentioned creative helplessness or hopelessness earlier. And so part of this kind of group think is such that the same patterns of ineffective behavior about, challenges that they've experienced can be shared. And so once other people are hearing, hey, it's not just me that has these same concerns, it then creates this kind of opportunity for more flexible behavior, and great ideas about flexible behavior come out of that group think.
So to get a little bit more into the procedures, Adam, you did mention in the article, you wrote it, I made a star next to it,
He did.
that you can contact the first author of this article and ask for more detail about all of the exercises completed. So I'm holding you to what you wrote down, and I'm going to ask you about a couple of the exercises, if you could describe them to me, because they sort of jumped out at me as I don't know what this exercise would be. So I would love to hear a little bit more information. So one that the first one I liked was your life as a movie. What exercise is that, and what part of the, I mean, you lay it out in the table, but could you just kind of for the listeners describe what part of ACT that was, and what that activity looks like?
Yeah, so your life as a movie is, and I'll mention before I answer that, is that all of the ACT components are interrelated. And I think I mentioned that earlier, but when you try to isolate the components and the metaphors specific to those components, what ends up, I believe, happening is kind of there's this interplay between the components that you're touching on. So to say that any one of the exercises is only one of the components wouldn't be entirely accurate. That having said that, your life as a movie typically captures or alludes to self as context. Okay. Mm-hmm. And so if you could think back about your life as a movie, and instead of being the person playing the role of you are watching that movie. Mm-hmm. Right. And so some of the things we might say during that exercise are, what would you want to tell yourself, if you're watching the things that are unfolding? What's something kind you might say to yourself that when you were living it, you didn't? Mm-hmm. And so you kind of get this distancing, right? You get this distancing between you as you're living it, or being the actor in the movie, and you as a bystander, kind of a person in the audience watching the movie occur. And that is the space where we can kind of create this self-compassion, I think. And so a lot of the work that happened in these exercises and across our time together was about, having some compassion, even though it didn't make it onto the paper. Mm-hmm. A good bit of this was dedicated to the parents saying, that they love themselves and care about themselves, and it's okay not to be okay.
Mm-hmm. How about milk, milk, milk? I was guessing that one had to do with the idea of repeating a verbal statement to the point that it no longer has meaning, to sort of solidify the idea that, verbal behavior is just that. It's not the same as, necessarily the same as an action. Am I on the right track?
Yeah, that's right.
Okay.
No, that's it perfectly, actually. So this stems from what's called Titchener's repetition. And the idea is that, as you just said, as you continue to repeat things, the topography of the word tends to kind of lose, it starts to sound like jumbled mess. Mm-hmm. And concurrently, the function of that word starts to lessen. Mm-hmm. Right? All of the things that accompany that verbal utterance are now not as potent. And so milk, milk, milk is kind of a go-to for, again, diffusion. It's a diffusion exercise.
Now, do you have a favorite exercise when you are conducting ACT that you love? You get so excited when you get to it, and you can't wait to tell everyone about it?
So I think there's probably two. Mm-hmm. I'd say my favorite is the clipboard. In essence, what you do is sit across from the client or the parent or whomever it may be, you let them know or ask them, what are some of the things that they care about. This kind of ties all of the processes in, but most often people allude to values when they think of this exercise. So sit across from them and say that, just behind me are all the things that you care about that are most important to you, right? And you can see those, and you can, as a therapist or clinician, you might hold your hands up and kind of show them where those things that they care about lie. And then you hold up a clipboard and have that individual actually hold it up and continue to hold it up and keep holding it up. And the clipboard, we place all of the barriers, we place any of the bad feelings, thoughts, or emotions onto that clipboard, all the things that kind of get in the way of engaging in behavior in line with those values. And so they're holding this clipboard up and their arms start to get tired, right? And so you ask them, what do you want to do in response to getting tired? And they say things like throw it away or, pitch it down. And then your next move is you press against the clipboard. So all the things that, are aversive are pressing against them. And again, their arms get tired, right? So they want to get rid of that clipboard. That's the most common response. Mm-hmm. And then the third piece to that is holding it right in front of their face, right? And so kind of along the same lines of, us trying to fix and control things, we want to get in front of the problems and fix them immediately. And the only way to do that is to have it right in front of us and try to, then manipulate it or push it around. Mm-hmm. And what happens when we engage in behavior like that is that we lose sight of our values, right? And so you ask them how easily are you able to see the values that you care about behind that clipboard that's 2 inches from your face? And of course they say they can't. Mm-hmm. So you then ask the question, what's an alternative response to the struggles with this clipboard? And 9 times out of 10, they'll say something like, well, I could just set it down. Mm-hmm. Or set it in my lap. And so that's a very important kind of response, because it's not to say that they're getting rid of those thoughts, feelings, and emotions. Mm-hmm. Rather, they're still carrying them around, they're still with them, and yet they can see their values and the behavior that they can engage in, even in the face of those challenging thoughts.
And so how would you do that in this group format?
Yeah, so there would be someone would volunteer. A lot of ACT is about willingness instead of being told to do something, because that then just gets back to just get rid of it or just push it down, right?
Okay, yeah.
Who's the willing person in the audience, right? And once they come up, you work through it with them. And so everybody gets a little flavor of what that looks like. And regardless of whether you're the person up in the front of the room or a person sitting, you often have, and it's not a requirement of any of these exercises, but a lot of people have the aha moment.
Mm-hmm. I wonder, it would be interesting to do research on, looking at the direct effects of being the participant versus being the audience member.
Yeah,
right?
it could
and
be
see
cool.
The behavior change, if there's the difference in behavior change of actually doing it or just observing it.
Mm-hmm. Yeah, I'd be interested in that. That's a good empirical question.
Yeah.
I'd wonder if there would be, some vicarious or observational learning that took place.
Or not, right? So
it would
be really important
not.
to know that, because if you're basing, the entire workshop off of that assumption, it would be really important to know if that assumption is actually correct, right? And it'd be so cool, you could move forward knowing that and feeling confident that, everyone's accessing the same type, of therapy.
For sure.
That would be
neat. That's a good research question.
Yeah.
And Adam, what was your second favorite exercise?
I think because of the population it's got to be math problems and sunsets.
I was just reading about that part.
Yeah, it's an interest. Kelly Wilson, I believe, created it, but it's the idea that how do you view you as a parent, right? You as a parent, how do you view your kids? Are they, and all that they bring to the table, are they a problem? Are they a math problem to be solved? And are you kind of always trying to figure out and fix the problem to solve it? Or is it possible that we could simply sit back and enjoy it, enjoy our time with our kids, as if you might enjoy a sunset? Mm-hmm. And that tends to resonate with parents who often have, every parent has struggles, but, oftentimes individuals with autism present some different challenges, and parents respond differently to those. So this gives a little bit different perspective.
Oh, I love that so much. And you found that parents responded well to that when you presented that part?
Yeah, again, it's like you start to see, interestingly, it's one of those responses that's non-vocal verbal. Mm-hmm. There's a softening. They kind of very measurable. If I were to kind of videotape this and say, what's the body language, quote unquote, change from time 1 to time 2, I could certainly kind of qualify and quantify that.
Yeah, because you're saying that these families were receiving ABA therapy, so they probably are used to working with a BCBA, and our go-to is always like, what's the next action? What's the next thing we should do? What's the next homework we should give a family? And I have had a few times where I've had a parent ask me, like, what should I do during this time period? Or how can I incorporate this at home? And I've said, just enjoy your kid.
Yeah.
Just have fun with them and just enjoy being with them. And you see that softening. I know exactly what you mean, because no one can predict what's going to happen. And life is really complex and hopefully long and rich. And you just got to take those moments when they come and try not to, nothing's ever going to be perfect,
I think what we often see is perseveration, right? Mm-hmm. They're individuals get tangled up in the things that they tell themselves about what they need to do. And in doing so, there's this perseverative thinking, perseverative behavior on fixing and solving and doing. And oftentimes it's quite nice to sit back and not have to problem solve. So.
Mm-hmm. Yeah, just allowing parents to enjoy their kids.
Mm-hmm. So following your 2 sessions, you had the parents do the post-test of the questionnaires, and the results came out very positive, or some of them came out more positive than others. Would you mind kind of breaking down the general results? I'm not familiar with all the questionnaires, so I mostly just looked at the graphs.
So if just to kind of orient you to the figures, or figure 2 specifically, these are all the assessments that we used, and on the far right side of each of the little panels, there's an arrow. And that arrow is indicative of the direction for improvement. Mm-hmm. The figure caption alludes to that. And so it kind of paints a nice picture of kind of the movement we get with the ACT versus the control groups. And if I remember correctly, all but 1 had, maybe 2, all but 2 had statistically significant improvements with some pretty big effect sizes for a number of them.
Yeah, and these are small groups that you were working with here.
Mm-hmm.
Yeah, small groups, and so that's a limitation for sure. Is that we've got this really brief exposure to ACT, and it was again purposively brief.
Since you saw statistically significant differences with such small group N size, that's pretty significant in and of itself.
Yeah, I mean, I think that's a glass half full way to kind of look at it, right? I think, the researcher in me wants more participants, but this is where the data landed, right? I mean,
sure.
One of the things that I think you mentioned earlier that you'd like to hear about were barriers. And one of the biggest barriers was recruitment.
Yeah.
It took me an entire year to recruit these participants.
That makes me sad for you.
Yeah, it hurt.
Yeah.
It hurt. And I'm better for having done it.
Oh, absolutely. Yeah.
Because these, like I said, these were parents who didn't have all the time in the world to kind of throw to a graduate student who was trying to help them out, who were, symbiotically trying to help me out. And so it was quite the grind, but worth it.
Mm-hmm.
It might be cool to look too if you ever had a chance to like replicate these results and extend them, to look at maintenance data and see if like a month down the line or 6 months down the line, if students were or if parents were still actively employing the techniques that they learned in the workshop, and if they still reported such good and positive measures.
Yeah, I think that's certainly something that can and should be done. And back when I conducted this study, that was the idea that we would.
Always the idea, isn't it?
It's always the idea, right? To get maintenance and follow-up data. It just so happened that too many of them had kind of moved on or inaccessible after this. So
yeah, that happens. That's a junk of research, really.
Yeah, especially when you're, even in the finite time that I was asking of them, it's pretty tough to keep people around. So, But yeah, maintenance data, and then obviously some overt behavior and measurement of would be a great addition, and part of a replication should we want to do it.
Mm-hmm. Adam, I know, just discussing the one article, I feel like we have so many more questions, but unfortunately I know we're going to start running out of time. So if we're all okay, I think it's probably a good time for us to seg into our dissemination station with some concluding remarks. There we are. We made it into the station.
It was a hard train ride here.
Yeah.
Phew.
Adam, I think some of the points that I'd love to hear more about in terms of ACT is, we talked very specifically about your work with parents of children with autism, and while I think a lot of the challenges they were going through would be similar to other individuals, what research is there, or is there research, I guess, I assume there must be some, in terms of using ACT in other populations or for other mental health challenges?
Sure. I mean, most of the work that has previously been done is anxiety, depression, chronic pain.
Mm-hmm.
There's some neat work being done with end of life care.
That's neat.
Work with individuals with cancer.
Mm-hmm.
ACT has some pretty significant influence and, I guess, implications for individuals who are suffering from addiction.
Mm-hmm.
Kelly Wilson wrote a great book called The Wisdom to Know the Difference.
Mm-hmm.
And it's couched, from a perspective of ACT as it overlays onto addiction. Again, I think kids with autism is another area in which there's starting to be some research. The one question that I have is, I think it's the question of, what type of verbal repertoire and skills are necessary for an individual to find benefit from exposure to ACT. And I'd caution, behavior analysts and clinicians just broadly about, using it for everything, kind of an umbrella for any and all challenges, because we just quite simply don't have a good sense of for whom it's appropriate, if it's specific to individuals with autism and related developmental disabilities. So I think that would be a neat area to explore, one that my lab is about to start looking into.
I think that's so important to note, because when I have spoken to, I guess, newly knowledgeable ACT clinicians, they have been really, really excited about it and wanted to do it with everyone and everything. So I like that you've added that caution. With all things that we're doing, everything should be used with caution until we have the data to support it.
Yeah, I mean, I think you hit the nail on the head. Ideally, we get a build-up of data to support the use of these strategies and technologies and training and therapeutic approaches, because in the absence of data, I think that it's a little bit not only risky for us as clinicians and the ethical parameters, but potentially dangerous. So I have healthy skepticism about ACT and its use for, kind of broad strokes. So,
So if one were behavior analyst wants to learn more about ACT, I want to start being an ACT therapist, which I guess that's redundant.
ACT.
What would you recommend
Therapist.
would be sort of the best course of action to learn more about ACT, to get the chance to even maybe practice? I know it's not manualized necessarily because that takes away some of the strength of the therapy, but what would be your recommendations?
Yeah, there are a lot of great resources available to anyone who wants to know about ACT. One of the first that I would probably point people to is the Association for Contextual Behavioral Science. Mm-hmm. That association is values-based payment, so you pay what you view the association and your membership to be worth. There are lots of free resources there. So as you become a member, you then subsequently gain access to assessment materials. You get access to the Journal of Contextual Behavioral Science, in which my article will be published. Mm-hmm. A lot of other great resources, like very diagnosis or disorder or challenge specific ACT applications. Mm-hmm. There's a podcast that's called ACT in Context. And they just recently did a reboot of that. Mm-hmm. So there's a lot of great information through ACBS.
Cool.
ACT in Context, and that journal as well. But then you'll also notice that some of this stuff is starting to kind of bleed in and make its way into our more notorious journals. So keep an eye out on our journals too. Yeah, the infamous journals, right?
Well,
excellent.
Adam, thank you so very, very much for taking the time out to talk about ACT. I mean, I guess, we always love it. We love the idea of, we did the episode on ACT and we said everything there possibly is, but wow, no, not even close. But it was good to get an introduction and then to look at a specific population, especially since we could hear about it from someone who did that work with that population. So it was a real treat. And I know I learned quite a lot about ACT and the process and the underpinnings of the whole therapy. So thank you very much.
Yeah, thanks for having me on. It was great to speak with you all.
If listeners have questions or want to contact you, is that?
Absolutely. So my email address is the first two initials of my first name, AD, and then my last name, HAHS, @asu.edu.
Sorry, everyone. I just want to interrupt us one more time before we wrap up to talk about our second secret code word.
You're
and it is
such an interrupter.
I'm such an interrupter, too. Mountain. Mountain is our second secret code word. MOUNTAIN. Mountain. Like Mountain Everest. Or Mountain Himalayas. Or Mountain Vesuvius.
Or that guy in Game of Thrones.
Oh, yeah, that big guy. The Mountain. Mountain. Once again, we want to thank Dr. Adam Hahs for being on the show today and talking with us all about ACT. We hope you all enjoyed listening to the show. I want to also thank Jackie and Diana for being here. And of course, thank all you listeners out there. We really hope you enjoyed the show. Why not subscribe to us on Apple Podcasts, Spotify, Stitcher, or, wherever you like to get podcasts. You certainly can also Feel free to leave us a review or write to us on any of social media. We're on Instagram, Twitter, and Facebook as ABA Inside Track. We're also on YouTube where these episodes get posted. You can also find us at our website, abainsidetrack.com, and feel free to email us at any time at abainsidetrack@gmail.com. We'll be back next week with another excellent episode about behavior analysis, but until then, keep responding. Bye!
Bye.